Yeah, Tom, that sounds great. We're glad that Sadie's doing much better, and like I said, we'll just be able to see you this evening for her final set of blood work, just to make sure her kidney values are back down to where they're supposed to be. And if that all looks good, she's in the clear. And I'm glad that we were able to catch it as early as we did, and she's doing well. And we'll look forward to seeing you this evening. Yeah, no, I'm glad we were able to help out too. That's kind of why we're here. So if anything happens between now and then, certainly give me a call. But otherwise, we'll see you later on tonight for her final blood tests. That's great. You too. Take care. Hi, everybody. My name is Dr. Bryan Langlois, and I'm the medical director and staff veterinarian here at the Pet Pantry of Lancaster County. And I was just on the phone with one of the grateful members of the public that we were able to help out. Their dog, unfortunately, had gotten quite ill very quickly, and he did not have the funds to afford regular veterinary care. And those of us that work in the nonprofit realm with nonprofit institutions a lot of times are able to help out a limited number of people in those situations. Fortunately, the disease that his dog had contracted, leptospirosis, was caught very, very early, so there was very minimal damage, and we were able to get on top of it very quickly. But still was a little bit of an expense that he, unfortunately, because of economic hardship that he was going through at the time, it was unable to afford the cost of regular vet care. And while we love helping out people in those situations, that's why organizations like the Pet Pantry and many other nonprofits in Pennsylvania and throughout the country exist, we're not able to help everybody. And I know that veterinary care to a lot of people is expensive, and certain procedures do cost quite a bit of money, especially if they're in the emergency realm or major surgeries, or if you're looking at treating a long-standing illness such as a cancer or some other debilitating injury or disease in one of your pets. It can be expensive, and none of us in the veterinary community really are doubting that or trying to really make excuses for it. Unfortunately, though, we as veterinarians, we do carry quite a high debt load. And there's a huge debt for newer grads coming out. There's the overhead of the clinic that the veterinarian has to be worried about, as well as paying his staff, making sure that they're taken care of, as well as keeping up to date with all the modern equipment to be able to provide the best care for your pet. So believe me, I understand that veterinary care can be expensive at times, and while we do try to make it as economical as possible, fees do have to be charged. And we just can't afford to do everything very, very cheaply or inexpensively, or we would basically go out of business, and then everybody would really be having problems. So the question comes up a lot of times then, well, what else is out there that can potentially help me cover the cost of the veterinary care for my pet? And one thing that probably is not utilized or looked into enough by a lot of pet owners is pet insurance. And I know everybody hears the word insurance, and all of a sudden their skin starts to crawl. They maybe get a little twitch in their neck from having to, research human healthcare plans, and the plans are always changing. Mine personally just changed without my knowledge. And so I had to go through the fun thing of staying on the phone for 3 hours to sort it out and get a new plan set up under the different plans that are out there. And then all of a sudden, well, what kind of plan is my pet going to have? Is it going to be kind of like a managed care setup where only certain things are approved and certain things are not? And am I going to have to pay a copay, or the copay is going to be different? What is it only going to cover a certain percentage of the care? Is there going to be deductibles? All of this stuff comes into play, and can cause quite a lot of anxiety in people, and rightfully so. I will say that the pet insurance realm, for the most part, does not work like that. Probably because veterinarians know how much of a hell the human healthcare side has become when it comes to all these different insurance plans and having to deal with stuff and things like that. And trust me, we want nothing to do with that type of system, because we don't have the time to really sit down and deal with all of it and figuring all of that stuff out and working with a whole bunch of different organizations and companies and plans and all that stuff. So pet insurance basically works by reimbursing you for the cost that you've incurred for your pet at the vet. And there are many different companies out there that offer things. There are many different plans out there that offer things. And it all depends on how much research you want to do to find out a plan that may work or may not work for you. And just like you would spend some time researching plans for your own health insurance to make sure you're getting the best, it's advisable that you research all the pet insurance plans that are potentially out there and see what fits. There are premiums with it, so you will be asked to pay either a monthly or a quarterly amount to be part of the program. And depending on what level of care you're looking for your pet, pet insurance can cover everything from, every single vet visit that you go to, for vaccines, for routine checks, for blood work, for things like that. Or you can get a plan that maybe more covers just the catastrophic event. So, for example, your dog suffers a severe trauma, or your cat does, such as getting hit by a car. Your cat or dog, unfortunately, is diagnosed with cancer and has to undergo maybe some surgeries and then some chemotherapy after that. Perhaps there's another type of long-standing or more debilitating illness. Maybe it's something as simple as your pet being diagnosed with diabetes, and just covering the cost of the care that's involved with that, as far as the follow-up testing and insulin costs and other treatment costs. So, do some research into the different plans that are out there. And a lot of the plans do reimburse at 100%, which basically means that the veterinarian is not having to cut their cost way back, or only getting reimbursed partly for something which really can affect their business, and you're getting the best quality care that your pet can possibly get. The other thing that pet insurance has been shown to do is, and you'll hear a lot of veterinarians again always talking about preventative measures, preventative medicine. That's what we're about. We want to be able to catch things early, or even prevent diseases from occurring before we have to deal with them when they're a long-standing problem. And I can tell you from personal experience, in the realm that I'm in, we in nonprofits and shelters usually do see a lot more serious medical conditions that are due to chronicity, in which case the animal could not get the proper care when it was first seen with the issue, and so now we're trying to fix something that could have been prevented a long time ago with more adequate care. And pet insurance can go a long way to that. They've actually done studies that have shown that people that have pet insurance are more likely to go for yearly veterinary exams, do things like dental prophylaxis and teeth cleanings, and other issues that will help give us the best preventative care possible for your pet, than those that don't. And that's because in some ways you are getting almost fully reimbursed for the cost. There are some questions that always pop up when it comes to pet insurance, and a lot of the questions usually surround more like, well, what will you cover and what won't you cover when it comes to plans? And every plan is a little bit different, and usually they will cover pretty much almost everything. Sometimes they will not cover a congenital condition or something that's hereditary, such as hip dysplasia in dogs, or some other orthopedic issues that may be a result of poor genetics or things like that. Some of them may also not cover a pre-existing condition. And this is important because basically what that means is you really want to try to get your pet under an insurance plan as soon as you acquire them. So either as a puppy or kitten, if you're getting there, or if you're rescuing an animal, first of all, thank you for doing that. That's a great thing. And if you're rescuing an animal from a shelter or another organization, a rescue such as that, try to get them on a plan as soon as possible, because the sooner you get them on the plan, if another condition pops up, especially if you're adopting a middle-aged or older animal, those things will be covered. They may not be covered on a plan if they were pre-existing beforehand. So how does the whole process really work? Well, for the most part, here's how most of the plans work. And again, you do have to kind of, see each one and see how they're doing. But basically, the way it works is this. You will enroll in a plan, and you will get a whole bunch of information, about what's covered, what's not covered. When you go to your vet and bring your pet there for, be it just regular routine checkups and care, or if it was an emergency situation, something like that, there will be a sheet that you can print out, or that will be given to you by the insurance company. You have to fill part of it out, and you hand it to your veterinarian. Your veterinarian then fills out exactly what was done, what the diagnosis was, what treatments were needed, and all of that. And then that sheet is sent off to the insurance company. And you still do have to pay for the care up front. There are some plans out there that sometimes will work with your vet a little bit and reimburse them directly. They're not quite there yet in a lot of the plans, so you do still have to pay a majority of it up front a lot of times. But you will be reimbursed fairly quickly. That sheet is then faxed or mailed off to the insurance company. They look it over, they make sure everything looks good, and then you will get a reimbursement amount check sent directly to you to cover the cost of that veterinary care. So that's basically it. It's actually really simple. No major hoops to jump through or anything like that. It's really kind of cut and dry. And normally, if you've seen some of the other stuff I've done, I don't mention specific products by name because we're not necessarily endorsing one thing over the other. But with the PVMA, I am going to say that PVMA has partnered with Pet Plan Insurance Company. And Pet Plan is actually a wonderful, wonderful insurance program for your pets. They do cover a lot. They give you a lot of choices, and they really, really cater to exactly what your pet might need. So if you're watching this at the farm show, we do have these brochures all around, so be sure to pick one up and look for information about how to get Pet Plan insurance. And also, because we're partnering with Pet Plan and the PVMA, there are discounts available, and you can sign up through your veterinarian. Your veterinarian will have information if they are one of the participating practices that are willing to work with us on this, and there will be codes that you can enter. And even if you go to our website, pavma.org, again, pavma.org, there's a section all the way over on the right of the screen that says for pet owners, and it'll see a pull-down menu. It'll say pet insurance on it. And that will also give you some information as to how you can enroll in Pet Plan insurance and get up to a 10% discount in the costs. And the beauty of it also is, if you want to really feel good about helping other animals, is a small portion of every sale that's made through that system with the PVMA and Pet Plan will go towards the Pennsylvania Veterinary Foundation and their Last Chance Fund, which goes to help animals that are really in need where the money is not there to help them. So it's a win-win. You really can't lose in any way in this situation. So please, check out Pet Plan. You can also, like I said, check out their wonderful brochures. Check them out on the web, which is gopetplan.com. That's where you can learn about all about enrollment. And if you have any other questions about it, be sure to check up with your vet or contact the PVMA. We'll be more than helpful to help you go over all the stuff that's needed and get the plan that's right for you. So this is Dr. Bryan Langlois with the Pennsylvania Veterinary Medical Association, reminding you to definitely look into pet insurance. And while you're looking into it, always remember to take your pet to the vet, not the net.